Hi, Steve Hines here again. Just following up from the video I sent you probably about a week or so ago now, talking about slip discs and why they're not necessarily a huge problem, and just sort of highlighting that point again is that they've conducted research on people that have absolutely no back pain, and 60 to 70% of them actually have these spinal pathologies, including slip discs, and they have no pain whatsoever. So having a disc bulge or a slip disc on an MRI doesn't necessarily mean you're going to have back pain or have any sort of problems in the future. But what I want to talk to you briefly today about is just the 4 treatment options that you've got for your back pain, or actually the 5 treatment options. Treatment option 1 is do nothing, right? If you do nothing, nothing's going to change. You're going to have back pain. It may get better of its own accord in 12 weeks, and if it does, brilliant. Okay, and then the next thing you can do is take painkillers and anti-inflammatories. Now, when I recommend people do this, I hear a lot of times patients saying, well, I don't want to take painkillers, or I don't believe in painkillers or anti-inflammatories. Well, yeah, don't take these things long term, but if you're in a hell of a lot of pain, there's nothing wrong with taking them for a week or two. God, it'll make you feel better for a start. So you can take paracetamol and you can take ibuprofen, maximum non-prescribed doses. So that's what the dose that it says on the back of the packet. If that's not happening for you, then get along to your GP, and your GP might be able to prescribe you something a little bit stronger. But take the painkillers because it will help the pain. Okay, the third treatment option is physical therapies. Now, I don't want to just say physiotherapy, because chiropractors and osteopaths do a good job as well. Pilates instructors do a good job. So it's physical therapies. You may need some hands-on treatment from manual therapists like me, like a physio, where we can mobilise the joints and stretch muscles and ligaments and joint capsules and mobilise nerves, etc. And then really what you need to invest in longer term is a management strategy, an exercise system, whether it's yoga, Pilates, whether it's some core stability exercises, Swiss ball exercises, something to make your back, your core, your abdominals, your pelvic floor, your glutes, something to make them strong and build an engine of muscle around this previously injured part of your body, your back. Okay? And then the 4th treatment option is a steroid injection. Now, if you've got a particularly painful back, it's not settled down after sort of 8 to 12 weeks of painkillers, anti-inflammatories, physical therapies, then what we would normally do is refer you on to one of our consultant colleagues. Now, their first treatment option would be to give you a steroid injection. And again, people say, steroid injections, they're bad for you, they're going to cause problems long term. Well, actually they're not. It's just an anti-inflammatory liquid that's injected down to where the inflammation is. And sometimes it can make your pain go completely straight away. Sometimes it can get significantly better, may need another one a little bit down the line, but it gives you a window of opportunity of having less pain or being pain-free to do your physical therapy. Okay, so if you need one and the consultant's recommended, I'd go for one. And then the 5th treatment option is surgery. Now, the surgeons that I work with, they say this is the absolute last resort. If it's a medical emergency or you've failed with all of the other conservative treatments, is to have surgery. But surgery is irreversible. Once you've had something cut out or once you've had your bones fused together, you can't undo that, okay? So the good surgeons that I work with, they want you to stay in the conservative phase. They want you to take painkillers and anti-inflammatories when you need it. They want you to do your physical therapies and have steroid injections when you need them. Okay, so think about that. And in terms of physical therapies, do the exercises that I've shown you in the guide. They'll help you.